The history of clean rooms is inextricably linked to two strands of technological advancement: medicine and military. The medical applications can be traced back to attempts to create a clean environment, first for field surgery and later for operating rooms, whereas the military applications can be traced back to attempts to assemble precision engineered mechanisms in environments where dust particles posed a risk to the device mechanics. Depending on the industry or technology surveyed, tracing the origin will yield a different answer. The complication arises because clean rooms were developed in two distinct ways. The first path was industrial, with the military, atomic, and space fields having the most influence on clean area development. The second path was medicinal, with the development of operating theaters being the most significant innovation. One of the earliest recorded industrial concerns about environmental cleanliness was expressed by a Swiss watchmaker who covered his watches with a glass jar when they were not being worked on due to dust concerns. This use of a bell jar was arguably one of the first design attempts to create a clean space. The use of air filtration, in addition to an enclosed space, is the most important mechanism for keeping an area clean. The development of an air filter by John and Charles Dean in 1823, who devised a smoke protection filter that afforded some protection to firefighters from the acrid smoke and dangerous chemicals in the air when fighting fires, improved this perilous activity. The air filter device was later adapted for use by underwater divers and for Connie McPherson's gas masks, which were used during World War I, as well as providing the design concept for the HEPA, or High Efficiency Particulate Air Filter.
Surgeons during the American Civil War were aware of the environmental risks associated with field surgery. Army doctors, for example, speculated that the spread of pus formation from one patient to the next was most likely airborne. Furthermore, in 1864, the American Medical Association advocated for improved hospital ventilation as a means of creating cleaner air. Although contamination from air, equipment, surfaces, and people was widely acknowledged as a significant risk during surgical procedures, little progress was made in improving cleanliness until Lord Joseph Leicester's work was accepted. Leicester was concerned about the spread of post-operative infection, so he pioneered the use of aseptic methods in surgery. In order to limit infection, Leicester experimented with surgical dressing soaked in carbolic acid to cover the wound, as well as hand washing, sterilizing instruments, and spraying carbolic in the operating theatre while surgery was performed, inspired by Louis Pasteur's works on ways to destroy microorganisms.
While methods of reducing air cleanliness were attempted, most notably with ultraviolet radiation in 1930s, the Second World War was the next significant step in the concept of a clean space, and this was driven by industrial rather than medical application. Military technological developments accelerated during World War II. The need to assemble small-sized critical components such as gun mechanism and aircraft gyroscope in clean environments prompted the development of fire rooms. These were areas where ventilation was increased and air conditioning systems were used to filter the air. These filters are part of air handling unit, were initially referred to as a separate impingement or super interception filter before being renamed absolute filters. Filtration was further developed with gas masks designed as something to the HEPA filter, with esparto, grass, and asbestos used as a filtration medium.
Absolute filters were created as part of the Manhattan Project to remove and capture radioactive dust and particles from the air inside laboratories. Arthur D. Little, a research and development firm, was in charge of the project. The Little firm created the first absolute filters to capture particles 0.3 meters and larger, based on the filter's design specification to effectively capture condensed radioactive iodine. When compared to today's HEPA air filters, the first air filters were quite large. After World War II, absolute filters technology was declassified and it became available for industrial use in the early 1950s, serving as the primary component of heating, ventilation, and air conditioning systems.
From this point forward, cleanroom technology evolved into what it is today. Contamination was the issue, and cleanrooms were the solution, regardless of when they were established. Cleanrooms, as we know them today, are recognized for their low levels of pollutants and contaminants. They are constantly growing and changing for the betterment of projects, research, and manufacturing. Through the cleanliness of cleanrooms has varied over time. Their purpose has remained constant. As with any evolution, we anticipate that cleanrooms will continue to evolve as more research is conducted and air filtration mechanics improve.